Welcome back to Daytime, everyone. Did you know that your thyroid can cause weight gain, depression, fatigue, poor memory, chronic pain, and anxiety, just to name a few? How do we know if our thyroid is functioning as it should? Joining us now is cardiothoracic surgeon Dr. Robert Carlson to talk more about this. The thyroid. Good to have you here, Dr. Carlson.
Thank you for inviting me.
What is the function of the thyroid?
Well, the thyroid is the source of all your energy. It helps your hair, your skin grow, your fingernails. It gives you the ability to lose weight or not to gain weight. But more importantly, it gives you that energy, especially in the later part of the afternoon when you're running out of it. It controls all the metabolism in your body.
I think a lot of us hit a wall around 3 o'clock. I know I do. Could I be blaming this?
Could be.
Could it be in here?
It could
Is this
be.
where my thyroid is exactly?
Yes. In fact, that is. The thyroid is located right about here.
Okay.
And the brain, the pituitary, monitors the thyroid. It uses something called thyroid stimulating hormone. Now, that's been used for monitoring your thyroid. Unfortunately, I see so many people come in, they're exhausted, especially at 2, 3, 4 o'clock in the afternoon. Their hair is falling out, their skin is dry, they can't lose weight. They exercise. I see ladies exercising 7 days a week, can't lose weight, and they go to their doctor, he checks their TSH, says it's fine, you have no thyroid problem. That's wrong.
Okay, how do we find out then what's wrong?
You need to look at more things than that. For instance, the thyroid produces something called T4.
T4.
T4 travels to the liver and has to be made into T3. T4 does nothing.
Okay.
T3 is the active form. It's kind of like driving along the highway. You got 4 lanes, you're moving along, go down to 1 lane, and you drive past this construction area. There are all these construction guys, 9 of them are standing around. T4, one of them's working.
T3.
The T3.
So we need to activate our T3 and up it somehow.
You have to. You need to. And if you're not doing it, for instance, people on beta blockers for blood pressure do not make T3. People who are on statins like Lipitor, Pravachol don't make enough T3. And the biggest thing is stress. Stress blocks the activation of T4 to T3.
Oh, so if I ask my family doctor, I need you to test me for my T3.
Yep.
He or she can do that.
Absolutely.
It's a simple blood test?
It's a simple blood test, and they need to know that. Not just the TSH, not just the T4, but the T3. More importantly than all those numbers, and more importantly than all those reference ranges and normal values, is how you feel. If you're exhausted in the afternoon, if your hair's falling out, your skin's dry, you're gaining weight or you can't lose it, there's a problem.
You've had a patient come to you saying, look, I've really restricted my diet, and yet I continue to gain weight. And you did a test, and it was the T3 not being high enough. Okay, how do we up our T3 then? There's the million-dollar question.
It's very simple. And the process of finding it is quite simple. You identify the T3, but treat the symptoms. You can use something called Armour Thyroid, which is or any combination of T4 and T3.
Is that a supplement?
It's a prescription medication, but it's natural. And the thing is that a lot of the standard chemical ones they use in the pharmaceuticals only gives T4, not T3. So it makes sense that if your T4 is not being made into T3 and they're giving you a bunch of T4, it's not doing anything.
No.
So you need to give T3, and that's when people get this tremendous energy boost. And the thing about stress, for instance, I had a lady who's 34 years old. She's struggling in her career. Her husband's struggling in her career. They want to take their house away. There's so much, and she's gaining weight. She's exhausted. That's because stress blocks T4 to T3. When that occurs, she's not going to get better until you replace the T3.
Eliminate the stress. Easier said than done, but you got to work on it. Some people, well, if you become conscious that that's the root of the issue, then that's something you've got to deal with. Then when you start treating and to up the T3 in your body, how quickly can you start to feel better?
Actually, in a few days.
Really?
I have a lady up in Chicago called me and said, I can't believe it. I've been on Synthroid for so long, which is just T4, and I put her on the Armour, and she says, in 2 days, I can't believe it. I have energy in the afternoon. I want to go through things now. I want to go work out. I want to go do things with my husband. I want to ride my bike. Well, not in Chicago right now, but she wants to do those things.
Okay, well, there you go. Dr. Carlson, thank you very much for coming in and telling us about that.
It was my pleasure. Thank you for inviting me.
You can find more information at daytimeonline.tv. There you go. Still to come on Daytime, street surfing. What the heck is that? Do you know?
I have no idea.
Lindsay's going to tell us. We'll be right back.